Okay. So welcome, everyone. Thank you for hanging in there with us while we were having some technical difficulties, but we are ready. Matthew and I have been working very hard on this webinar, so we are excited to be able to go ahead and present it now. So welcome again. This workshop was created by JDI and CALCASA, and it's part of the Advancing PREA project. It was developed to help advocates in the rape crisis centers to be more aware of special populations within the larger group of people in detention. And my name is Juliana Baez, and I am the Training and Technical Assistance Specialist at CALCASA, and I will be co-presenting with Matthew Winkle, and he is the Program Officer at Just Detention International. Matthew?
Hi, and thanks very much, Juliana, and thanks so much for dealing with so expertly and quickly with ILINK. As many of you know, JDI is a health and human rights organization that seeks to end sexual violence in all forms of detention. And it's JDI's core belief that when the government takes away someone's freedom, it takes on an absolute responsibility to protect that person's safety. No matter what crime someone has committed, rape is not part of the penalty. We don't accept sexual abuse as an inevitable part of prison life. We know that prisons and jails with committed leaders, good policies, and sound practices can keep inmates safe. Juliana?
Thank you, Matthew. So the California Coalition Against Sexual Assault is committed to ending sexual violence through a multifaceted approach of prevention, intervention, education, research, advocacy, and public policies. The California Advancing PREA project is there to offer support and guidance to all California rape crisis centers on how to build strong relationship with CDCR staff, create sustainable agreements and protocols for provision of victim services and the survivors as well. Briefly, the project has three main goals: to help advocates and prison staff understand each other's roles and cultures, to build the capacity of rape crisis centers and prisons, to provide trauma-informed services to survivors, and to develop a program of services for survivors that is sustainable. In today's training, we are going to share some stories of survivors, including some quotes. So please practice self-care during the workshop. Take some deep breaths, step outside, which is some of the stuff that we've been practicing with the technical difficulties. Doodle, do whatever you need to do to take care of yourself as well. On the agenda today, we have four main topics. We'll provide an overview of what it means to be disabled in a correctional setting, information on disability types commonly reported in detention, and information on how to best provide crisis service to incarcerated survivors with disabilities. We also identified and addressed concerns about the challenges that you may face in doing this work. Now, I want to invite everyone here to utilize the chat box and start just thinking of what your level of confidence is when working with survivors with disabilities. So if you can share, one or two words on what level of confidence you feel at this point working with survivors with a disability. And, it could even be that you just don't have any experience with that, and that's okay. We want our audience to share what their feelings are, how they're feeling if they were to service someone with a disability. It could be in the community or in detention. So feel free to share. Great, thank you for sharing. So Shauna and Susan share that they are very confident, which I'm glad, so that you are confident in working with, survivors with disabilities. And we want to just start thinking about how that's going to look a little bit different in detention facilities. So the reason why we presented the question was so that we can start those wheels, start making those wheels turn a little bit and start thinking about, this is already what I know, so how is it going to be different from detention? Moving on, I want to ask our audience as well, which group of people do you think are more likely to be targeted for sexual abuse behind bars? And we've presented this question before, but we wanted to present it after touching bases on disabilities to see if your responses change a little bit. We hear a lot about, LGBTQ people being, more likely to be targeted, or people of smaller stature, but shifting a little bit in the thought and being more aware of the disabilities, what do we think are the groups of people that are more likely to be targeted for sexual abuse? Thank you, Susan. Yeah, LGBTQ is definitely, yeah. Yeah, and these are all good answers. And just like similar in the community, inmates with mental illness, inmates who may be of a smaller stature, inmates who are inexperienced, inmates who are in a wheelchair, or who are blind or hard of hearing tend to also be targeted for sexual abuse behind bar. So now I'm going to turn over to Matthew, and he is going to tell us a little bit about what we know about people with disabilities in detention.
Thank you, Juliana. An inmate with a physical disability can face challenges in the restrictive environment of a jail or prison, especially in more antiquated facilities. And frankly, some of those we see around California have an interesting history, to say the least. In this section, we'll explore the difficulties a detention setting can pose for those with the most commonly reported kinds of disabilities. Some difficulties may be more obvious than others. And we should remember that even outside prison walls, if reasonable accommodations aren't made for people with disabilities, they encounter significant barriers to employment, education, and other opportunities, and that these barriers also affect an inmate's ability to program and rehabilitate. Factors like low education and poverty are overrepresented among people with disabilities in and out of prison. Now, how do disability rates in detention compare to those in the community at large? In fact, just as with racial and ethnic minorities, the BJS study of 2011 and 2012 found that disabilities are overrepresented in detention. In fact, the data shows that jail inmates are 3 times more likely and prison inmates are 4 times more likely to report having a disability than a member of the non-incarcerated population in the United States. Due to efforts to deinstitutionalize people with disabilities, there has been a reduction in the number of people with disabilities living in hospitals and institutions over the past several decades. But because greater efforts were not made at the same time in the independent living movement to address this change, the rate of incarceration for people with disabilities has increased since the 1980s. Now let's look at a chart. We do love our charts. In this chart, the Bureau of Justice Statistics shows the prevalence of disabilities among state and federal prisoners and jail inmates. They gathered data on disability types including self-care, independent living, hearing, vision, cognitive, and physical disabilities. The prevalence rates indicate nearly 1/3 of all state and federal inmates have at least one of these disabilities, and approximately 40% of all jail inmates have one or more of these disabilities. Female prisoners were more likely than males to report having a cognitive disability, but were equally likely to report having each of the other 5 disabilities listed here. As we all know, among the many factors overrepresented in our nation's prisons are those who suffer from mental illness. We'll discuss a little bit later how mental illnesses differ from cognitive disabilities, but we want to highlight that having a disability can impact mental health. Beyond the apparent challenges that a disabled person might face, there also comes a heightened risk of experiencing what is known as serious psychological distress. Compared to those without a disability, prisoners with a disability were about 4 times more likely to report serious psychological distress in the past 30 days, according to the Bureau of Justice Statistics in their 2011-2012 study. Just to provide a little more context on that term, serious psychological distress, or SPD, as I might shorten it, is kind of a blanket term that agencies such as the Bureau of Justice Statistics and the Center for Disease Control use. And from a clinical standpoint, a person is judged to be experiencing SPD based on a score of 13 or higher to a series of questions: how they answer, how often in the past 30 days they've felt so sad that nothing could cheer them up, nervous, restless or fidgety, hopeless, that everything takes extra effort, and feelings of worthlessness. But in an advocacy setting, we can simplify that. We can just say this is someone who needs help. As advocates, you encounter people every day in the community who would qualify as having SPD. And SPD is observed even more often among people in detention with disabilities. Now, earlier in this webinar, we asked you to tell us which groups of people you think were more likely to be targeted for sexual abuse behind bars, and your answers were right on the money, very insightful. We always want to make sure, too, to include voices of survivors, which inform our work. Here, we're going to share with you the words of Edward, who was a gay survivor of abuse in detention, who told us some of his story by letter. Edward has a visual disability and experienced both sexual harassment and retaliation for reporting the abuse. As Edward puts it, I was shaken down and asked inappropriate questions about my sexuality, my disability. I wrote an informal grievance. I'm a visually impaired inmate, and staff took away my assistant. Retaliation. We appreciate Edward's courage for coming forward and reminding us of the realities that inmates with disabilities may face. And incarcerated inmates with disabilities, they often do meet allies among their peers to assist them when needed. Unfortunately, sometimes these allies can feel unseen by the institution and don't always feel confident in their role. These are the words of an inmate at the California Institution for Women who shared with us her experience as an ally for some of her peers who have disabilities. As she says, my job here is a pusher. I push people in wheelchairs and assist with day-to-day stuff for a lady who has trouble walking. I receive no training and have no idea how I'm supposed to help. That isn't right. She should be helped, or I should be trained by someone who knows what they're doing. She's lucky I'm a kind person who wants to do this. Most pushers get assigned and don't really care. And that's scary. Juliana?
Thank you, Matthew. So after hearing all the data and all the amazing charts that we do love, let's talk a little bit about, let's focus on some time on common disability types and detention settings as reported by inmates. But first, I want to briefly look at the American Disability Act and its applications in the correctional setting. The Americans with Disability Act, or the ADA, is a civil law that was passed in 1990, which guarantees that people with disabilities have access to various same benefits, goods, and services, such as employment, public accommodations, transportation, government services, and telecommunications as people without disabilities. According to the ADA, a person with a disability has a physical or mental impairment, and we'll spend some time comparing those and defining those, that substantially limits one or more major life activities. Or if recorded having such impairment, that the person is having such a hard time with just basic living skills. CDCR facilities do comply with ADA standards, and for those of you who've been able to participate in just visitations or tours, they do have them posted all over the facilities as well. The Americans with Disability Act, or the ADA, defines a disability as a physical or mental impairment that substantially limits one or more of the following major activities. And a major activity is defined as a general life activities such as multitasking or seeing, hearing, eating, sleeping, walking, standing, lifting or bending, reading, concentrating, and it also includes limitations with major bodily functions. Now, let's think a little bit about how this looks in our agency right now. I want to spend some time, just a couple of minutes, and ask everyone to use the chat box and think of how does your agency address the needs of survivors with disabilities in the community. So start thinking about if you have a survivor that is in the community, and the survivor is hard of hearing or is blind or is in a wheelchair. How does your agency accommodate for those things? So if we can utilize the box, the chat box, there we go. Great, yeah. So Joanna's sharing that they contact ASL, so outside agencies. Good. So some of the things that we can provide to our survivors in the community would be, through different types of communication, interpreters, accessing the building. A lot of buildings are now ADA approved, access to material or support from outside agencies, which sounds like you all are already participating with and doing. Thank you, everyone, for sharing. Now, we do want to identify the common types of disabilities that are commonly seen in detention. And there is no universal acceptance definition of a disability, but the 4 disabilities listed here are the 4 most commonly reported disabilities from the Bureau of Justice Statistics in their survey of 2011-2012. These are hearing, vision, physical, and cognitive. These 4 disabilities are commonly seen inside detention. Throughout, as we're identifying these disabilities, we are going to give just a brief definition of how the CDCR sees this disability. So these are CDCR defined, and just some challenges and a little more statistics. And we'll spend some time on just developing the advocacy part as well. So hearing, according to the CDCR, hearing impairment can range from hard of hearing to deaf. A person is considered deaf if the hearing loss is such that they are unable to understand speech and must rely on vision for communication. In detention, a person who has a hearing impairment will have a difficult time getting around the prison, and they are typically housed in same prisons or wear vests, and they are modified. There's modified procedures for them, such as verbal announcements or flickering of lights or door-to-door notifications, so that they are aware that they are trying to communicate with them. And according to the Bureau of Justice, 10% of inmates in the U.S. report being hard of hearing as well. So here are some things that we can consider when working with incarcerated survivors who are hearing impaired. And you all have the tools to work with survivors with disabilities. All we want to do is spend a little time on setting it apart or thinking of our setting as a different setting now. So some of the things that we can consider is to let the person who is deaf choose the method of communication with hearing. We are trying to empower our survivors. So by letting them choose this, we are allowing them to tell us how it would be best for us to communicate with them. If interpreters are not readily available, consider having a communication message board and or a whiteboard so that you can have conversations and delete them immediately. Be aware that some people who are deaf will not have the vocabulary for rape, so they might not be able to tell you that they were raped, but that there was some sort of a sex crime or someone using different wordage for rape or defining or explaining that. And also be aware of who you're talking to when your survivor is present. Again, we want to empower our survivors regardless if they're in a detention facility or not. So be aware of who you are talking and who you're communicating with as well. Now, vision impairment can range from blindness to relying on glasses. For CDCR purposes, vision impairment means that an inmate is unable to see or read. The facility, an inmate with the vision impairment or some of the issues that they can have is that they could be segregated from general population. They have options such as having a cane or inmate assistance, again, wearing a vest, having someone help them with reading and writing. So this could put them in the target, right? This can make them more vulnerable for that, for sexual abuse as well. The BGS reports that 7% of youth inmates have reported having a visual disability as well. Now let's talk a little bit about what we need to know or some of the things that we can do when working with incarcerated survivors with vision impairment. Remember to offer any assistance directly. Don't assume that they need help. Identify anyone who enters or leaves the room, so constant communication with them. Let them know who's coming in, who's leaving, when you are coming in or when you are leaving as well. And I think one of you did mention that you are looking for outside support, outside agencies as well, so make the agency materials available in alternative formats like Braille or enlarged print. I know sometimes during the forensic exams, the advocates provide a waiver document, so have that available for them as well. And if the survivor asks for assistance, contact verbally. So we are providing a lot of information on how to work with survivors with disabilities. All we want to do is just place this scenario out here and start, just so that you start thinking about how it looks differently or how these settings will look differently. So you don't need to respond. I just want you to start thinking about it, and I'll read the scenario. So during a phone call with a survivor who identifies the person with a hearing loss, you notice that she seems distracted. You hear the noise of a busy day room in the background, and she says, "I'm sorry." It's always like that. So start thinking about the suggestions, or how would you advocate for this survivor to have a space that is more appropriate for them, a space that is safe for them. How would you start doing that? And start thinking about it. You don't have to respond. It's just thinking about it. Now let's spend a little time with mobility impairment. Mobility impairment includes any limitations to transporting oneself and may include the use of assistive devices such as a wheelchair or a walker or a cane. In detentions, inmates with a physical disability will receive housing accommodations like a ramp or grab bars, a lower bunk, lower tier housing, or an extra mattress to accommodate. CDCR may need to make modifications to the path of travel so that the inmate can have access to the halls or programs or different assignments. Again, they might also be wearing a vest, but they this one's a little silly, but they're not required to stand up when alarms go off. So if they are in a wheelchair, they are being tagged with their vest as well. And according to the BGS, about 10% of U.S. inmates report to having some sort of a mobility impairment. Some of the things that we can consider in working with survivors with a physical disability is that when we offer an assistance, we, again, do it directly. We don't assume that they need the help. Communicate with them. Be aware of the space that you will providing the services, and if accommodations are needed, so plan ahead for that. And be aware that the survivor might not be able to participate in all the activities that you might be able to provide. I know some RCCs might be offering groups, and they might not be able to participate if they have no access to these buildings. So an inmate at the California Institution for Women who has a physical disability shares the challenges that are faced inside detention. We need help. No one cares about us here, and we have no support for our community and what we need. I use a cane, and I'm afraid of falling all the time because it's not accessible here. If I can't get around, then I'm limited in what I can do. So sometimes I do nothing. Then I get really depressed. So again, I'm going to present a different scenario. This one is as well just so that you start thinking about how this will look a little bit different compared to how you provide the services out in the community. So if you receive a call to provide follow-up emotional support services to an incarcerated survivor who uses a wheelchair, when you ask where you will be meeting the survivor for the counseling, you are told that because of ongoing construction, the wheelchair cannot be brought into its usual interview room. Now, if that happened, what would you do? And start thinking about that, and we're going to revisit these scenarios again one more time.
Thank you. Thank you, Juliana. And just so everyone knows, Juliana and I are not in the same room, so if there's ever an awkward transition like that, it just can't go off faces. Thank you very much. Now we're going to turn on to cognitive disabilities. A cognitive disability affects a person's mental processes, the way they are able to think, make decisions, and navigate their environment. A person can be born with a cognitive disability, or it can be caused by trauma. It's a term that's used to describe diagnoses as different as Down syndrome, traumatic brain injury, learning disorders, and dementia. The BJS finds that among disabilities experienced by inmates, cognitive disabilities are by far the most common, reported in 20% of inmates in American prisons and jails. We want to make sure to distinguish now between cognitive disabilities and mental illness. Cognitive disabilities and mental illness sometimes occur separately, but can occur together in varying degrees. Both cognitive disabilities and mental illness have an impact on how a person perceives and moves through the world, but they're different from one another in several key respects. And here's a list, by no means complete, of some of the important ways a cognitive disability differs from a mental illness. The biggest general difference between the two is that while mental illness can be a permanent condition, a cognitive disability will always be a permanent condition. In keeping with that, a cognitive disability, unless it's caused by a traumatic brain injury or a traumatic injury to the head, usually is expressed at birth or during development, while a mental illness can onset at any stage of a person's life. A cognitive disability is not treatable by medication, while patients with a mental illness can be aided by prescribed drugs. A cognitive disability will be typically diagnosed by a psychologist or an MD, whereas mental illness will be assessed by a psychiatrist. And this next point is a subtle one, but it's important. A cognitive disability acts as a limiter on a person's thoughts and ability to understand. A mental illness, on the other hand, can disturb thought processes and affect a person's perception of reality, expressing itself in hallucinations sometimes, for example. Down syndrome, learning disabilities, autism, dementia, traumatic brain injury are all cognitive disabilities. Diagnoses such as depression, anxiety, schizophrenia, mental illnesses. A daily routine, a sense of being able to predict with some certainty what will happen in the course of a day, is important to most of us in varying degrees, and especially important to people who have a cognitive disability. Suffering sexual harassment or sexual assault, followed by a visit from an advocate they have not met before, means that this survivor has already been placed far outside their zone of comfort. As I know you're already aware, the initial counseling session with a survivor can sometimes be off topic, but it will be the first step on the way to the survivor's healing. You'll use the skills you already have to find ways to explain your role and connect to the survivor in the way that they need. Now we're going to get interactive again. We'll ask you to type in your thoughts in the chat box in response to this question. How will your agency address the needs of people with disabilities in a detention setting? And if you're already working with incarcerated survivors with disabilities, please let us know what you've found effective in serving them. It's quiet, but that's all right. I can think of a few just examples here. For example, if you were corresponding with a survivor who might have limited vision, you could choose to print the letter in a larger font to accommodate that person's need to be able to read clearly what you've written. It's also just always great and very important to remember that we have agency in partnering with staff at the facility and building alliances in there. The more you can personalize that relationship, then the more you're going to be able to advocate for various needs. If someone needs to make a call from a private room, for example, in order for someone with a hearing disability to be able to make out what you're saying on the other end of the line, or better yet, in person, if we need that. Susan, finding support they need and advocating that they receive it. Yeah, I mean, it's absolutely true. Yeah, it's in some ways, even when we talk about people with specific needs, really the basic tools of advocacy are always in effect, making sure that they get what they need. Thank you. Now, the Prison Rape Elimination Act. It wouldn't be a California Advancing PREA training without the Prison Rape Elimination Act. Many of you are already familiar. You've seen some of this material before. I promise it's going to be just a brief re-intro. The Prison Rape Elimination Act, it was passed in 2003 after years of hard work by advocates and survivors working in collaboration. It's a civil law that did not create any new crimes, but it instead describes a course of action to eliminate sexual abuse in detention. It states that sexual assault in detention is a violation of the 8th Amendment of the U.S. Constitution, which prohibits cruel and unusual punishment. PREA called for three key things: nationwide studies to find out more about sexual abuse in detention, funding to help corrections facilities implement the law, and binding national rules, which we call now the PREA standards. Those were released in 2012. PREA requires that facilities adopt a zero-tolerance approach to sexual abuse, meaning that they must take actions to demonstrate that no sexual abuse exists. PREA requires that facilities provide access to medical and mental health care to survivors at no cost, as well as emotional support services provided by advocates, which are as close as possible to the community standard, which of course is where you all come in. Juliana?
Thank you, Matthew. And just to continue with the conversation about the PREA standards, I'm going to briefly introduce the PREA standards that do apply to servicing incarcerated survivors with disabilities. PREA Standard 115.16 talks about inmates with disabilities and how they are receiving special accommodations, and we go forward to screening and discipline and education, and all these are available for you under the PREA national website as well to help you in the advocating for survivors with a disability inside our corrections or our detentions as well. Now we're using these standards so that we can discuss some of the challenges that you will be facing inside a detention, such as the etiquette or sensitivity, confidentiality, accessible sexual assault nurse exams, and accessibility to follow-up services. Now, advocates are experts on sensitivity. Just like in the community, you make no assumptions based on the appearance or communication. Abuse survivors may have extremely limited knowledge about sexual activity again. And all standard rules of confidentiality apply when serving a person with a disability, with the exception of states which have mandatory reporting laws, reporting abuse, neglect, or exploitation of adults with disabilities. Extend the same respect for client confidentiality for a person with a disability as for any other survivor. During a forensic exam, work with the SANE and other members of the SART to make sure that the sexual assault survivor with disabilities are being incorporated into their service efforts, and try to provide or communicate with outside agencies so that you can provide the best communication to the survivor with a disability as well. Now, we've been talking, we were able to provide some recommendations and some things to start thinking about when you are working with a survivor with a disability. Here we have some recommendations from the Florida Coalition Against Sexual Violence for the agencies themselves, such as including an ADA compliance training for all the staff. It's always important to just be familiar with the ADA and how it affects your work on a daily basis. Engage in local disability advocacy cross-training. So join or invite other agencies to join your trainings and join there so that you start learning how to communicate, how to be more familiar with certain disabilities. Be intentional about ensuring that staff and volunteers are diverse and represented so that survivors are included or feel included in the process of healing. So if you know someone who's able to interpret, be able to have that staff as well. Again, ask disability advocates to join your SART team. They understand the disability more than sometimes we do. So ask them to join you, be part of their communication and their contact. Recruit and enlist feedback for primary and secondary survivors on service providers. So that just means that, how can I help the family members as well? How can I support those, supporting those with disabilities? In detention facilities, Matthew, in one of the quotes, he mentioned that there are people who are helping them and they push the wheelchairs or they're assisting them. So they might be a secondary survivor as well. And think ahead on how you can ensure confidentiality concerns. How can you have these conversations with your survivor with disabilities in the most confidential way as possible? So here we just created a quick list on some of the recommendations for advocates. And you're already doing work with with survivors with disabilities, so you might have these, and some of them might be repeating themselves, but they're always important to keep in mind. The more we hear them and the more we practice them, the easier they will be to apply. So remember that you have these skills. You have the skills to work with survivors with disabilities. The difference now is the setting. These are in detention. So the same modifications that you would do to servicing a survivor who might not have disabilities might be the ones that you need to do for someone with a disability as well. Use a strength-based approach and always follow the survivor's cues. They, just like in the community and just like survivors without a disability, they know what's best for them. Ask questions, never make assumptions, and never be afraid of making a mistake. We all make mistakes and we learn from them. Matthew?
Thank you. Thank you, Juliana. And now let's revisit the scenarios that we introduced a little earlier, and you can type your thoughts about how you might respond to the situation in the chat box. During a phone call with a survivor who identifies as a person with hearing loss, you notice that she seems distracted. You hear the noise of a busy day room in the background. I'm sorry, she says. It's always like this in here. What are some suggestions that you could make to ensure that she is served? I'll just give a few, a little time for typing, and then. And don't be afraid to make mistakes, as Juliana just reminded us. Susan, that's a great suggestion. Susan says going to the facility in person, finding a quiet room with paper and pen to write. Shauna, absolutely. Meet her in person. Mm-hmm. Yeah, those are great ideas, and they speak to the power that you have as an advocate to define some of the terms of the services that you're providing. That you can make those suggestions. Oh, brilliant! Yeah, correspond via written correspondence and letters until you can do an in-person meeting. Yep. And we find that many times, a written letter, even though it can feel kind of antiquated to us, sorry, I'm making sure I'm caught up here. Even though it can feel like a little bit of an outdated form of communication, these letters are really valued and treasured and held onto and kept by the survivors who receive them. And unlike a phone call or an in-person meeting, a letter is something that you can pull out at 1 in the morning if you're feeling sad or need to be reminded that you have value, and you can take renewed sustenance from that. Yeah, and again, the in-person services, trying to find a quiet room to talk to her in, written correspondence. In some cases, it may be possible to, if your partnership is strong with the facility, you can ask a friend or an ally you have on staff there to help arrange for a private room to be used for a phone call. This is just great. Thanks everyone for your thoughts on this scenario. Now let's move on to the next one. You receive a call to provide follow-up emotional support services to an incarcerated survivor who uses a wheelchair. When you ask where you'll be meeting the survivor for counseling, you're told that because of ongoing construction, the wheelchair cannot be brought into the usual interview room. The family visiting room is offered as an alternative. What are some suggestions we can make to ensure that this survivor is served? Again, I'll just give a couple seconds here. Brilliant. Yep, Susan. I think you're right. The family visiting room is not in itself disqualifying as long as it's empty and private at the time that you're doing your counseling. We can be flexible, but it's you do need to ask that question and make sure that you'll have that space to yourselves. Yeah. Well, I think just to kind of tie up on that scenario, we just see that as another opportunity to kind of partner with staff and make sure that we're really using all the agency that you have at your disposal, making sure that our survivors get as close to the community level of care as possible. Ask reasonable questions and advocate where you can. Thank you. Now we have put together a list of resources here for you that you can use to further your learning on this, including the Americans with Disabilities Act website, the BJS website. That's one of our main sources of data and information about America's inmates. It's a very rich resource of in-depth analysis and hard numbers. The PREA Resource Center is an easily searchable online version of the entire PREA law. It's a very fast way to get answers about what the law requires. JDI and CALCASA's websites also host a lot of great information, archived webinars and publications. Particularly relevant to the topic of this webinar is the CALCASA produced manual on survivors with disabilities. Now the link for that was a little too long to include here on this slide, but we will make sure that you all get a copy of that link. And we do have some time now for any other questions you might have, and be very happy to field any questions you might have. Well, while we're waiting for questions, Juliana, do you have any kind of wrap up or thoughts you want to make?
Yeah, we know that you all have the ability and the skills to work with survivors with disabilities, and thinking about it in a detention setting tends to make it a little bit more challenging or a little bit more confusing. So you already have the tools, and utilize those tools. Ask those questions. We are all here for that support. You can even ask those questions to your facilities, Start asking a little bit more about their ADA, just in basic conversation, like, hey, where is the ramp? Or where, if you need an interpreter, how do you contact one? Just start asking these questions. Never be afraid to ask these questions, because that's how you are, as advocates, going to start learning what they have there and what you need to advocate for more as well. Never be afraid of, knocking the door of the PREA compliance manager and say like, hey, what can I do for someone who is hard of hearing, or how can I help my survivor who is in a wheelchair as well? So never be afraid of asking these questions as well.
That's great. And I see we don't, a comment from Jessica, that facilities, yeah, that's a great point. Facilities may have an assigned ADA coordinator. That's true, and that would be a great person to be aware of and meet. Yeah.
Yeah.
Well, I guess, yeah, if there are no further questions, I see. We do have a question. What if the compliance manager knows nothing about PREA? That question gets at some of the truth, unfortunately. I hope I'm saying your name, Kenya. Sometimes being the PREA compliance manager is not a role that people want, or it's something that they're told that they're going to be taking on. It's not a native interest for them, and it is one of many other duties that they have on the facility. So I think it's that's where we can step up and really kind of inform that person. And you can use this team to help provide that support. We are ready to travel or hop on a call, make introductions, take a tour, get the ball rolling for you. If you really are encountering a situation that you're like, wow, this guy is not informed enough about PREA.
And just like Jessica and Liliana share a little bit on the chat box, yeah, these are great opportunities for us to provide additional PREA training to additional CDCR staff. We are aware that sometimes PREA is not part of everyone's job, but it is there and it does exist. So, and invite them to trainings. Talk to your facility and see how you can go in there and provide these trainings. And you can always use the PREA standards to advocate for your survivors with that, right? So that the standards touch bases on how there needs to be accessibility and how they need to have certain modifications in documentation or interpreters there for them. So utilize the PREA standards to say like, hey, ADA manager or coordinator, I need you to support me with this, or how can we work together in, being able to be compliant with the PREA standard as well. And that was a great question, Kenya. Thank you so much.
Yeah,
Is there any
thank
other
you.
questions?
Well, if you don't have questions now, do not hesitate to ask them later. You can reach us at either of these addresses. And we will, if we don't know the answer right away, we promise to find it for you. I think I speak for the whole team in saying that.
Yes, definitely. And yeah, again, ask those questions, have these conversations, and you are going in there with the role of helping them be compliant with these standards. So, approach that conversation like that. How can I help you be compliant with these standards while advocating for the support and the needs of survivors inside detention facilities? And again,
that's right. They need you.
Yeah, just like Matthew mentioned, we are here for that support, and we invite you to utilize our contact information at pri@calcasa.org or advocate@justdetention.org as well for additional TA support or additional questions. And a lot of the times these scenarios and conversations are very individualized and unique, just like each disability is. So you can always reach out, and we will definitely support you in that as well. Matthew, anything else that you would like to add?
Yep, just that you guys have all the tools already. It sounds like a cheesy 80s movie, but the power is in you. You already have the basics, and advocacy is for all. So thank you all for the hard work you do every day, and it's an honor to be partnering with you. Thank you.
Thank you, everyone, for attending, and please keep on the lookout for additional webinars that we are going to be presenting on more marginalized communities as well. Thank you.
Thank you, and have a good day.